I came home from the hospital on Sunday, and I was walking with a cane by Thursday. People who came to see me were dumbfounded by how well I was doing.
Relief from pain was immediate, and I was out of the hospital 3 days later. In a matter of a week, I was up, dressed, walking, driving, with small trips to the store for 1 or 2 items.
I was able to put full weight on my new hip with no pain. 6 days after surgery, I walked down and up the 2 flights of stairs in our house without favoring my new hip or using the handrail.
Anterior total hip replacement provides definite advantages for patients, even those in need of bilateral procedures. The procedure requires only a small incision, reduces soft tissue damage, and results in faster recovery for the patient with a significantly shorter hospital stay. Patients are commonly discharged 2 to 3 days after the procedure, depending on their degree of disability prior to surgery and overall capabilities. The Arch table extension, designed by Dr. Michael Meminger, developed by IoT and now available from TRUMPF Medical Systems, a leading medical technology innovator, is a vital development that can allow more hospitals to economically bring the benefits of anterior total hip replacement to more patients. The Arch is a leg-holding traction device that works with any brand of surgical table. It facilitates procedures including anterior total hip replacement surgery through safe, easy, and controlled leg positioning. The Arch is positioned at the foot end of any brand of surgical table. The patient's foot is placed in the Arch's traction boot, which is connected to and moves along the device frame. Optimal leg positioning, including critical positions such as hyperextension, abduction, and external rotation, can be achieved with constant safe traction and precise reference points. In anterior total hip replacement, the Arch facilitates lowering the foot towards the floor, rotating the leg, and extending the hip. This enables femoral access through the muscle-sparing and less invasive straight anterior approach. The most important muscles for hip function, the gluteal muscles that attach to the posterior and lateral pelvis and femur, are left undisturbed. The stability of the hip is immediate, and there is a reduced risk of dislocation because the dynamic stabilizer of the hip joint is maintained. The Arch allows unobstructed intraoperative imaging to control the position of the components, accurate placement, and proper sizing of the implants. With the Arch, the surgeon can reposition the leg to its starting point to allow correct limb length measurement. With the help of the Arch, the leg and hip can be rotated, extended, lowered, and lifted to check for stability intraoperatively. Since the Arch is less expensive than alternative solutions, more hospitals will be in a position to offer their patients the significant benefits of anterior total hip replacement. On a day-to-day basis, the Arch makes procedures more efficient, predictable, and easier to replicate. Additional economy may be realized with one less assistant required on the surgical team. Added value may be realized through applications in hip and femur fracture cases and hip arthroscopy.
If it were my mom or your mom that needed hip replacement and you knew that getting a special instrument would make it more predictable, safer, and better, you would want the hospital to spend the money to do that.
It's changed my life. No, it's given me my life back.